Hi, my name is Lynne Groeger. I'm a registered dietitian for Riverside Cancer Services, and I would like to talk to you all today about nutrition and physical activity during and after cancer treatment. And this is a presentation from the American Cancer Society that will give you all sorts of tips and ideas to help you get healthy and stay healthy. So the presentation is divided into two sections, during treatment and after treatment. And then we'll talk about some commonly asked questions. So first off, nutrition and physical activity during treatment can certainly help you maintain your weight and feel better during treatment, maintain your energy and strength and muscle mass. Decreased risk of infection, of course, is a very important component. Good nutrition will help you tolerate the side effects that you may or may not have, and of course, then to heal and recover more quickly after your treatment is done. So the basics of nutrition include adequate fluid intake, getting the right amount of calories to, roughly maintain your weight. Those calories come from protein, carbohydrate, and fat, and then also getting enough vitamins and minerals, ideally through your food. We don't generally recommend any high dose supplements for sure, unless prescribed by your physician. And we'll talk about vitamins and minerals a little bit more later. So priorities during treatment, definitely want to treat any side effects that you do experience. Don't hesitate to communicate with your care team so that we can address whatever is going on. Hydration is always a big deal for a lot of things. It definitely helps you feel better and sort of makes everything in your body work better. So when we are talking about good hydration, we're talking about at least 8 to 10 cups of liquid a day. It doesn't all have to be plain water. Any liquid that doesn't have caffeine in it and doesn't have alcohol in it contributes to your fluid intake. So if you're eating okay, then mostly water is ideal. If you're struggling to eat on some days, then using juices, milk substitutes, soups, things like that can sort of do double duty for your hydration and your nutrition. If you're having any trouble eating, and that may or may not happen, different chemotherapies have changed a lot over the years, so you might be able to eat just fine. But if you are struggling in any way, you'll often hear the recommendation of small, frequent snacks and light meals might work better than trying to eat like your usual 3 meals a day or whatever your normal is. We do recommend that you eat a little bit before your treatment. Going into treatment hungry isn't necessarily a good idea because patients often tell me that they sort of can't tell if they're hungry or nauseous. So let's keep hunger out of it. And certainly on bad days, again, just sort of going with what works for you. We would like, ideally all sorts of great nutrition, fruits and vegetables and all that. But if you are having some trouble eating on certain days, even if you were following a low fat or low cholesterol diet prior, you might need to maybe liberalize your diet a little bit. Of course, if you're diabetic, we definitely still want to try to keep your blood sugars under control. Our goals are also to help you maintain your weight or minimize weight loss. Now, again, chemotherapy has changed a lot over the years. Not everybody loses weight. Some of the treatments actually can sometimes cause some weight gain. So we don't necessarily want you to gain a ton of weight or lose a ton of weight. And a fluctuation of 5 to 10 pounds during treatment is not uncommon and not necessarily a concern. We sort of want to take a step back and kind of look at the big picture to make sure that you're not losing or gaining a whole lot. And so in general, we want people to roughly maintain their weight. And again, if you're unable to eat your usual meals and snacks or usual portion sizes, eating smaller amounts more often can definitely be more helpful in a lot of ways. Now, if you don't have an appetite, it sounds kind of goofy to tell you, well, eat more often. And yet the good part is that you just nibble on what you can nibble on and don't feel pressured to try to eat, your usual meal or snack, and just know that in a couple hours, you're going to go back and try again. It sort of takes the pressure off of you. And then the goal is to sort of accumulate enough nutrition throughout the course of the day to meet your body's needs. And some people do gain weight on treatment. So not to just assume that you're going to lose weight. And you'll hear a lot about protein, and protein, of course, is important. Typical American diet already contains plenty of protein. So if you're able to eat anything like your normal diet, you're probably okay on protein. But if you are on certain days struggling to eat, some high protein snack ideas can help you feel better. And you can see there's all sorts of ideas here. Cottage cheese, deviled eggs, you can sort of read through that and get the gist of what we're talking about. Some people do benefit from drinking the commercial nutrition supplements like Boost and Ensure, and there's all sorts of other brands out there nowadays. And the store brand varieties are generally just as good nutritionally, but certainly less expensive. But you don't have to drink these. If you're eating okay, you don't need this extra nutrition necessarily. And even if you're not necessarily eating great every day, homemade shakes and smoothies are often tolerated well and maybe enjoyed more. But certainly there's a place for the use of these commercial supplements like Boost and Ensure to help you get nutrition. So we'll go through some common side effects of treatment. Constipation is certainly a very common side effect, and for a number of reasons. Even just some of the anti-nausea medicines that work really well for nausea may contribute to some constipation. So first and foremost, try not to let more than 2 to 3 days go by without some bowel activity. Now, if you're preventing constipation, the bottom line is going to be fluid and fiber, fluid and fiber. Stay really well hydrated, get fiber in your diet from fruits and vegetables and whole grains. Lots of people like to snack on prunes because they work really well and they're sweet and chewy and kind of yummy. But if you're already constipated, then you definitely want to check with your nurse, doctor, nurse practitioner to find out what medicine to take, whether it be stool softener and or laxative. If you're already, 2 to 3 days without a bowel movement, putting fiber on top of that might not be the best idea. So prevention and management, fluid and fiber. If you're already on the constipated side, definitely find out what medicines you need to take from your healthcare provider and follow those guidelines. And so again, fruits, vegetables, whole grains, beans and peas, nuts and seeds. In fact, all of the cancer fighting foods tend to be high in fiber. And make sure you stay really well hydrated. That's going to be one of the big things that's going to help manage and prevent constipation. Some folks do, on the other hand, experience diarrhea. Some of the chemotherapy drugs, but certainly not all or even many of them, can contribute to diarrhea. So you'll hear then about following a low fiber diet, and it's specifically low insoluble fiber. And those foods that would fit the bill would be actually anything kind of white and starchy, white bread, white pasta, white rice, and then some fruits that are high in soluble fiber. So soluble fiber is good for diarrhea. Insoluble fiber would be better for constipation. And if you have really bad diarrhea, more than 4 watery loose stools in 24 hours, you may start with what we call the BRAT diet. BRAT standing for bananas, rice, applesauce, and toast. Toast being white bread, again, kind of anything white and starchy. Make sure you ask about what to take for your diarrhea in terms of medicine, and definitely stay really well hydrated. Sometimes people find that if they drink their fluids in between eating, that can also help to minimize diarrhea. Apple juice is kind of a funny thing. I hear different things from patients. Some people tell me it helps constipation, and other people tell me it helps diarrhea. So you just sort of have to assess that one yourself. Sugar alcohols are an ingredient in some low sugar or no added sugar products. And they would be on the label something like, on the ingredient listing, sorbitol, xylitol, mannitol. Even like sugar-free gum actually has a little warning on it not to overconsume it because it can contribute to loose stools. And that's because the sugar-free gums usually have sorbitol or xylitol in them. Nausea. Nowadays, nausea is generally very well managed with the really good medications that are available. And there's many different things that the doctors and nurse practitioners will try. So if what they have prescribed for you initially isn't working, let your care team know so that they can sort of tweak your anti-nausea medicines. And so if you follow along with those guidelines for medicine, you likely will be pretty well set. From a nutritional standpoint, the thing that really helps is that idea of keeping a little something in your stomach virtually all the time. Again, that kind of confusion of your body between, am I hungry or am I going to be sick? It apparently is kind of hard to tell when you're getting chemotherapy. So, snacking on those sort of bland, starchy foods, and just whatever sort of feels right for you, because of course everybody is different. And just keep a little something in your stomach most of the time, all the time. And certainly avoiding constipation, correcting it if it's already occurring, is going to be really important for avoiding that feeling of nausea. If you already feel full, you're not going to want to put anything else in. So make sure you're taking care of the constipation part. Taste changes are a very common side effect. And it kind of comes down to trial and error, is going to see, what works best for you. Often patients do find that cool or cold foods taste better than hot foods. Part of that is because they have cold and cool foods have less smell to them, and sometimes odors can, even something you would normally consider a good smell might not smell so good to you now. And then, as long as your mouth isn't sore and you're not nauseous, stronger flavors actually often work better for people. You might just need a bit more seasoning in your foods to get through to your taste buds that aren't working so well. And so kind of some of the tangy flavors seem to help people. And the number one tip for taste changes, rinse your mouth often, and certainly right before you're going to eat. Rinsing can help sort of clear out your taste buds, cleanse the palate, as they say, and help your food taste better, at least for a little while. It might not necessarily last for a long time, but if you can get 10, 15 minutes of 20 minutes of foods tasting better, that will allow you to eat a bit better. The plain water works for some people. Many people do like the baking soda or salt or both combination. A lot of people do like water with lemon. That seems refreshing to people. I've had folks tell me all sorts of interesting things. One patient told me that she used a drop of vanilla extract in her water, and that worked for her. Some people use cold black tea to sort of refresh their taste buds. So experiment, see what works for you. Food safety guidelines do become more important during treatment. We don't necessarily tell everybody that there's something you absolutely have to eat and things that you absolutely can't eat, but your food has to be safe. Your resistance to infection has been lowered a little bit. And so things that maybe might have a little bit of bacteria on them normally is not a good idea during treatment. You sort of really can't afford the complication of some food poisoning. So wash your hands often. We hear that a lot for many reasons, and certainly for food safety. Making sure that hot foods are hot, cold foods are cold. If you have any doubts, throw it out. Definitely don't recommend any raw eggs, any sushi that would have raw fish in it, unpasteurized cheeses, things like that. And if you do have well water, that should be tested before you start treatment to make sure that it's safe for you. And if you have any other special restrictions, your doctor will definitely tell you about that. So we definitely need a slide of an area where we hope none of you ever have to go, but of course it does happen that cancer can become more advanced. And I do want to take a second here to point out that palliative care is not the same as hospice care. People often get those terms confused and think that they're interchangeable, but they're not. Palliative care means that you're still getting likely treatment to manage your cancer. And if you start off with an advanced cancer, you may be getting palliative care right from the beginning forevermore. Hospice is different. Hospice is when, let's see, the criteria is expectation of 6 months or less. And so there, the focus is on comfort care, and you are no longer receiving treatment for your cancer. So they're very different. But in either case, of course, we want to manage your symptoms as best as possible. And there's lots of ways we can do that. All right, for the caregiver, don't let the food issue become like a power struggle or a big deal. You sort of do the best you can and be there to support your loved one in terms of offering foods, making sure that they're not having to spend the energy to prepare foods, and don't be offended if they don't eat or they say, this tastes terrible. And you say to them, well, you just had it yesterday. It tasted fine. Well, taste changes are a funny thing, and they are frequent and unpredictable. So don't be offended. If you've made too much of something that doesn't taste good to your patient, and you can't get it adjusted, sometimes if they're telling you it tastes too sweet, you could add a little bit of salt. If they tell you, oh, this is too salty, you could add a tiny bit of sugar or sweetener. You might play around with things, but if you have too much of it, put it in the freezer, labeled, dated, portion sizes, and then you can get things out as needed in the future. Okay, so now that was a bunch of the nutrition and eating stuff. Let's talk about physical activity. Cancer-related fatigue is pretty common, but physical activity is the number one thing that can actually help manage cancer-related fatigue. And again, it sounds kind of mean to say, oh, I know you're tired, but you need to exercise. But just take it little by little every little bit of physical activity that you can do will actually help to increase your energy level. And it will help to preserve muscle mass, which is what helps you feel strong and maintain stamina. It also keeps your bones strong, helps to relieve stress, and it really helps your immune system. I don't think people always realize that physical activity is so important for the immune system, and can certainly help you with weight maintenance. So you do want to ask your doctor if you have any restrictions on physical activity, and of course follow those, but starting very slowly, even a couple of minutes a day, and then increase little by little. The goal is to get about 30 minutes of physical activity each day, most days of the week during your treatment. And even if it's a couple minutes here and a couple minutes there, and you accumulate that 30 minutes over the course of the day, is great. And as you start to feel better and you tolerate physical activity, you could even think about increasing the intensity a little bit, maybe walking a little bit more quickly. Okay, so that was all the stuff about during treatment. And let's move on to what we might call survivorship, nutrition and physical activity after your treatment is done, or you maybe are getting a break in between your treatments. So number one thing is to work towards a healthy weight. And although none of us really like to hear about having to, what we think of as diet or lose weight or whatever, there is a pretty strong connection between overweight and obesity and the development of cancer, and also for recurrence. So when you're done with treatment or you're getting a break from it, working in healthy ways towards a healthy weight can help you now and later. So what is a healthy weight? A healthy weight, in my opinion, is where you feel best. Now, we can definitely look at like the BMI, body mass index tables, to get an idea of what is medically considered a healthy weight, the weight that is most associated with health and lack of health issues. So it doesn't take a lot of extra weight to be in that overweight or obese category. So don't be offended if your doctor tells you you're obese. It's certainly very common, but working gradually towards a better weight for you, again, can help your future and reduce chances of recurrence or progression. And even losing a small amount of weight, every 5% of weight that you lose, getting closer to a weight that's good for you, makes a big difference. You don't have to think about getting to your ideal weight, your weight after college or whatever kind of thing. Every little bit does make a significant difference. So weight management involves, a number of components. Certainly a healthy food intake, making sure that you're getting plenty of physical activity, because you're, calories in versus calories out, still the bottom line of weight management, despite all the other dietary information that might be out there. So we need to balance, what you take in and what you expend. And then certainly managing stress is a big part of weight management. We eat for so many different reasons, boredom, stress. Often it's not even hunger as the reason that is driving us to eat. So, stop and think every time you go to put something in your mouth. Am I hungry, or am I bored, or am I thirsty, or am I upset, or am I lonely, or, any number of different things that maybe addressing that is going to actually help you in all sorts of ways. And so activity, of course, is an important part of weight management. And whether you're in treatment or not, it still will help to improve your energy level. Certainly helps to manage stress, especially if you're picking things that you enjoy. Physical activity doesn't have to be, drudgery of exercise, doesn't have to be going to the gym or doing things that you hate. Any physical movement, going out and gardening, taking a little walk, playing with, your grandkids or the neighbor's dog or whatever, any physical activity is going to be beneficial to your body, helping to burn calories, to control weight. And again, the immune system. Physical activity is so important for your immune system. So how much physical activity do you need after treatment? Here, the American Cancer Society and most of the other, major medical groups are recommending at least 30 to 45 minutes of moderate to vigorous physical activity each day. And, at least 5 or more days of the week is recommended. If you're trying to lose weight, then you might need closer to 60 minutes a day. And we should be encouraging our kids to try to get 60 minutes of activity each day. And it doesn't have to be, a 30, 45-minute segment altogether. You can do all sorts of things throughout your day to get little bits of activity in. Take a walk whenever you have a break, doing things while you're watching TV. That old idea that many of you may have heard for years, park further away or take the stairs. That kind of activity really does help you out and build up your stamina. So if you don't have to be, don't be that person driving around the parking lot, waiting for the space closest to the door open up. Just go park and take a stroll in and you will feel better. Okay, so now let's talk about eating a healthy diet for survivorship. A cancer fighting diet is a plant-based diet. We would recommend that as much of your intake as possible come from vegetables, fruits, beans and peas, that legume family, it's starchy beans and peas, nuts and seeds, and whole grains. So now you might be thinking, where are all the other foods that I normally eat? So not to say that you have to eliminate everything that you love, but the bulk of your food intake should be these minimally processed plant foods. Aiming for 5 to 7 servings of vegetables and fruits a day is a #1 recommendation, not only for cancer fighting, but for diabetes management and heart health and all sorts of things. And a serving is basically a half cup cooked or cut up. If it's something light and fluffy like lettuce, then it would be a 1 cup portion to make a serving. If it's dried fruit, then it's only 1/4 of a cup. And if it's juice, we definitely recommend 100% fruit or vegetable juice, not juice drinks. And the portion size there would be 6 ounces. So fruit and vegetable servings, 1/4 cup dried, 1/2 cup cooked or cut up, 6 ounces or 3/4 of a cup if juice, and 1 cup if it's light and fluffy like lettuce. But the 1/2 cup portion is probably the biggest part to remember. So like if you're having dinner and you're having a cup of cooked broccoli, you've got 2 servings right there. And really the key to getting in a good recommended amount of vegetables and fruits is every meal and snack. When you are thinking about what am I going to have to eat, start with what vegetable could I have? What fruit could I have? And I want to mention something about fruit and blood sugar control, whether you're diabetic or not. It is definitely best to eat fruit either with a meal or if you're having it as a snack, to have that fruit with another food that contains some protein, fat, or fiber. So like the idea, maybe you want to have an apple as a snack, which is wonderful. Add a little peanut butter to that apple. And that way, that will help to keep your blood sugar levels more even, keeps you healthier overall, and definitely helps, again, reduce risk of progression or recurrence of your cancer because your blood sugar levels are too high. And we're going to talk about sugar a little bit more in the question section. Okay, and then portion sizes, choosing food and drink in amounts to help maintain a healthy weight. Lots of folks do actually eat a healthy diet, but it is still easy to overeat healthy foods, apples and carrots and whatever, lean turkey, they all have calories in them. So portion management, yeah, that's always something to pay attention to. And you've probably heard the tips and ideas of, using a smaller plate. And a lot of folks find that helps. Using smaller serving utensils and things of that nature may help with portion management. And eating till you're not hungry rather than eating till you're full is a key component of good weight management and eating healthfully. Another part of a healthy diet is to probably limit animal foods in general, I think is safe to say, for cancer fighting. So if you really like vegetables and fruits and whole grains and nuts and seeds and all that, you may choose actually to become a vegetarian, and we wouldn't recommend that during treatment, but after treatment, that could be okay. A vegetarian diet can be a healthful diet. Now, if you decide you're going to go vegan, no animal foods whatsoever, that takes a little bit of careful planning to make sure that you're getting adequate nutrition. So I do recommend getting some guidance from a dietitian on how to do a healthy vegan diet that will keep you healthy. So many of us are, accustomed to having some animal products in our diet. Fish and poultry in small amounts are fine. We do want to limit red meats, which is beef, pork, lamb, and veal. But it doesn't have to be eliminated entirely. I think red meat sometimes has gotten a bit of a really bad reputation. Small amounts are okay. Even up to 11 ounces a week is not necessarily associated with an increased cancer risk. So you don't have to avoid red meat altogether. Now, if you don't like red meat, you're fine without it. You can get all those nutrients elsewhere. The big thing with meats is avoiding processed meats. And this is probably really the only sad news that I have to tell you, that ham and bacon and bologna and hot dogs, any meat that stays pink or red after it's been cooked, which is cured, there's a kind of strong connection there with cancer, particularly colon cancer and gastric cancer. So really trying to avoid processed meats is important for everyone, whether you've had cancer or not. And nowadays we have these naturally cured bacon and hot dogs and whatever, where they're not using synthetic nitrites or nitrates, but using naturally occurring ones. Usually you'll see in the ingredient listing contains celery juice or sometimes cherry juice. And these products are very tasty. They're very much like the traditionally cured and processed meats. Are they safe? Not sure. Ask me 50 years from now, we'll definitely know a lot more. So if you use those foods occasionally because you're just really craving a ham sandwich or something, that's okay. But I would still recommend keeping those to occasional food intake, not regular or routine food intake. Limiting intake of refined grains, what we call white flour products, if you're not having diarrhea like we talked about earlier. So now we want to focus on whole grains, not refined grains. Snack foods can also get us into trouble sometimes. Now, if it's the apple and peanut butter, maybe you don't need to limit that. Certainly foods with a lot of added sugar are really important for everyone to try to avoid as much as possible, try to minimize. All our foods in the American diet nowadays have so much added sugar, and sometimes things that you don't expect, ketchup and salad dressing and canned soups or whatever. So really kind of checking your labels. A lot of times the nutrition facts label will separate out now underneath carbohydrates. It used to just say sugar, but nowadays it says added sugar. And those are the ones we want to limit, not the naturally occurring ones like in fruit or milk products. That's really the only naturally occurring sugar is in fruit and the lactose in milk. If you take the sugar out of fruit and you make a nice white crystalline powder that you can add to cookie dough, you've now got added sugar, right? Because you left behind all the goodness of the fruit that you took that sugar out of. Healthy fats can be very important for overall health. And the healthiest fats are things like olive oil, nuts, and avocado. Olive oil really has stood the test of time as being one of the healthiest fats that we can use. So trying to use that whenever possible in your cooking or, on salads or whatever. Nuts and nut butters, certainly very healthy type of fat and other good nutrients in there as well. And avocado is a good healthy fat. So particularly if you're having trouble maintaining your weight, that you have lost weight or you're still having trouble eating, fat is the most concentrated source of calories, and these healthy fats can help you keep your weight up where you want it to be. The fattier fishes, like salmon, are also healthy for us and give us good protein and a good type of fat. And recommendation of about twice a week would be great for a healthy diet. In terms of alcohol, this sometimes, or maybe often comes up during and after treatment. The American Cancer Society recommends no more than 2 drinks per day for men and 1 drink per day for women. I guess when I first started in cancer care 20 years ago, I was sort of surprised to learn that alcohol is actually classified as a carcinogen, and it does contribute to many different kinds of cancer, certainly all of the head and neck cancers, esophageal, liver cancer. It is a factor for breast cancer. So, if you've already had cancer and you can avoid alcohol entirely, that's great. Otherwise, these are sort of the maximum amounts allowed. And, 1 drink a day for women does not equal 7 drinks on the weekend. That is still not good for your health. And so for people who have learned about heart health, the question of, but I thought wine was good for me. So if you haven't had to enter into the world of cancer and you have a high risk for cardiovascular disease, that's where wine may be beneficial to you. I would definitely recommend talking to your doctor to sort of weigh out the risk versus benefit there. And the bulk of the benefit of wine actually does come from the grapes. It's only a small amount that could come from the actual alcohol component. So again, fruits, vegetables, all that good stuff. Okay, so now here are some common questions that come up pretty often. What about organic foods? So organic foods raised without synthetic pesticides or herbicides, may be healthier, but we don't know that for sure. We do know that eating plenty of vegetables and fruits is good for you. Even conventionally grown fruits and vegetables have, all sorts of good nutrients that fight cancer and, give you fiber and fluid and all that. So, if you can afford organic foods and they're accessible to you, there's not necessarily anything wrong with it, but feeling that you need to eat organic foods is definitely not a necessity. Now, there are certain fruits and vegetables that tend to have higher pesticide residues than others. Some fruits and vegetables, if you do any home gardening, some things just are more prone to being eaten by bugs or whatever than others. So there is the group called the Environmental Working Group that creates each year the Dirty Dozen list that you may have heard of. The Dirty Dozen is the 12 fruits and vegetables that tend to have the highest pesticide residue. Things like apples have often been on that list over the years. So if you're a person who eats an apple every day, it's worth even the few extra cents or extra effort to get to a place where you can find organic apples, for example. But actually, even Walmart has organic apples nowadays, so pretty available. Bananas are something that have often been on the Clean 15 list, the 15 fruits and vegetables that tend to have the lowest pesticide residue. So organic bananas, not necessarily as important as something from the Dirty Dozen list that you eat frequently. But again, fruits and vegetables, even conventionally grown, are a really important part of a healthy diet. The topic of soy, especially related to breast cancer, comes up quite often. And there's a lot of confusion on the internet about this. Once the bad information's out there on the internet, it's going to stay there forever. So it can be hard to find the current credible information. So the story with soy, even for women who have had estrogen sensitive breast cancer, is that whole soy foods are fine. Soybeans themselves may be in a bean soup. The young, green, immature soybeans called edamame, tofu, soy milk, anything made with the whole soybean is fine. The thing that we're not so sure about the safety of is soy protein isolate. So the item of concern in soy is what is called phytoestrogen, a plant source of a very weak estrogen-like compound. So you're eating the whole soybean, you're getting the natural mix of protein, carbohydrate, fat, actually quite healthy foods. Many researchers actually believe are beneficial to consume and are safe. The whole soy foods safe for women with estrogen positive breast cancer. But when you take the protein out of the whole soybean, and this soy protein isolate or soy protein concentrate is used as a food ingredient in sometimes protein bars, sometimes like soy burgers as a meat substitute will be made not from the whole soybean, but from soy protein isolate. That we're not so sure about the safety of, and so is recommended to be avoided or minimized as much as possible. Now, if you go get a soy burger and you didn't realize it, having the soy protein isolate, or you have a soy protein or a protein drink and you look at the ingredient listing and find out that, soy protein isolate is the first ingredient, once in a while is not going to make your cancer blow up and, get worse. But in general, trying to avoid the soy protein isolate specifically for estrogen positive breast cancer. I think that might be the end of the questions. Oh no, here we go. We've got, should I take vitamins? I do want to get back to talking about sugar again for a second, but should I take vitamins? If you're deficient in something and you're deficient because, for example, you've had your vitamin D as in dog, level checked and you're low, you should take a supplement and your doctor can definitely give you some guidance on that. Taking vitamin and mineral supplements has never been shown to actually be beneficial for avoiding cancer or fighting cancer. So a lot of people just feel more secure if they're taking kind of a basic one a day multivitamin, multi-mineral, and that's okay. Something that gives you about 100% of The recommended amounts for the nutrients it contains is fine. Is it necessary? Not so sure about that, but it's not harmful. We do want to avoid excessive amounts of nutrients because you can get yourself into trouble with taking too much of one thing that might interfere with something else. And then, of course, there's a lot of supplements out there that are neither vitamins or minerals that people take for a variety of reasons. It's worth checking with your favorite dietitian to find out more about those and whether they're, good for you or not. Taking supplements during treatment, you definitely want to check to find out if there is any interference with those supplements with your treatment. Sugar. People often ask the question about, does sugar feed cancer? And it is just not that simple. We should all avoid added sugar as much as we can just to have a healthy diet and to be healthy. But during how's the best way to explain this? Everything that we eat breaks down to sugar eventually. So it breaks down to raising our blood sugar. So we have to eat, right? Avoid added sugars. It's not the sugar in our diet that is directly the culprit. It really is that added sugar adds a lot of extra calories to our diet and contributes to overweight and obesity. Overweight and obesity often is associated with too much insulin. Now, of course, we absolutely need insulin. We need our pancreas to produce it to manage our blood sugar. But our crummy American diet leads often to too much insulin being made by our pancreas, which not only tires out your pancreas, but if there's anything driving cancer development, it's excess insulin from a crummy diet and being overweight or obese. So the reason that this is really important for people to realize is that during treatment, if you're really struggling to eat and you're losing a lot of weight, which is no good for your muscles, for your immune system, for maintaining your blood counts, and the only thing that you can manage is some ice cream, you don't have to worry that that is going to make your cancer worse. You do what you need to do to get by, and then when you're able to eat better, then you can make better choices. So it's a little bit of a complicated topic, but I hope that gave you at least a little bit more clarity on that. So I hope that this information has given you some useful tips and ideas. And thank you so much for joining today.